My name is Demetrius Smith, and I'm a senior at Liberty University. I'm currently completing my capstone, which is the final step before earning my Bachelor's of Science in Psychology with an emphasis in military resilience. For this assignment, I was asked to interview a local professional who holds a degree in psychology or a closely related field, and who is actively working in the profession. I had the distinct privilege of interviewing someone who is not only a respected professional, but also my big sister in Christ, Dr. Rosetta Parker-Austin. In this presentation, I want to walk through the 6 interview questions, share what she taught me, and reflect on how this experience connects to my own journey in the helping profession. Dr. Rosetta Parker-Austin is a licensed professional counselor, a supervisor, and the owner and founder of Rosetta Event Counseling. She holds a PhD, multiple master's degrees, and several bachelor's degrees in psychology and related fields. Her academic background alone shows her dedication, but the way she talks about her work shows an even deeper commitment to trauma counseling and multicultural care. When I asked Dr. Parker-Austin about her job duties, she explained that her work centers heavily on trauma counseling, and she works with individuals and families who've experienced child molestation, domestic violence, and other forms of severe trauma. Her long list of responsibilities include providing trauma-focused therapy, supervisor counseling or counselors and interns, offering culturally competent care, making referrals when clients need specialized services, maintaining multiple certifications, and managing her counseling practice. She made it clear that trauma work requires emotional resilience, cultural awareness, and the ability to navigate complex family systems, especially when working with both survivors and perpetrators. When I asked what she finds fulfilling, Dr. Parker-Austin said that helping trauma survivors reclaim their sense of safety, dignity, and stability is what keeps her going. She also finds fulfillment in preventing future harm, especially when working with perpetrators. She values serving communities that are often overlooked, witnessing transformation in clients who once felt hopeless, and being part of someone's healing journey in a way that is both clinical and spiritual. One thing that really stood out to me was her willingness to work with perpetrators. Most professionals I met tend to focus on survivors, and that's understandable. But she approaches trauma work from a broader, preventative perspective. She believes that addressing the root cause of the harmful behavior and intervening early can stop future harm before it happens. To me, that's forward thinking, courageous, and honestly, rare. She described her work as a calling, not just a career. When we talked about challenges, Dr. Parker-Austin didn't hold back. She spoke openly about the systemic issues within the counseling field. She mentioned that the lack of representation for Native American, African American, homeless, and female veteran populations. She pointed out that many counseling materials still focus on white middle-aged men, which leave major gaps in culturally relevant care. She also talked about the emotional strain on trauma work and the limited multicultural awareness among some practitioners. And then she highlighted something that really hit home: the barriers that prevent marginalized clients from accessing competent care. She explained that many clients struggle with inadequate insurance, limited finances, or simply not being able to afford consistent therapy sessions. These barriers make it extremely difficult for underserved populations to receive the care they need, even when they're actively seeking help. She emphasized that counselors must be intentional about cultural humility, ongoing education, and advocating for some inclusive practices across the field. Dr. Parker-Austin is deeply committed to lifelong learning. She takes 3 continuing education classes every month, maintains multiple certifications, and stays active in professional associations. One thing she said that really stuck with me is that she intentionally chooses mentors who don't look like her. She believes that diverse mentorship expands cultural understanding and challenges blind spots. She also stressed that staying updated on trauma-informed practices and multicultural counseling research is an ethical responsibility, not just something extra to do when you have time. When I asked for her advice for students entering the field, she offered several powerful points. She said to find a trusted counselor for yourself because you can't pour from an empty cup. She encouraged seeking mentors from diverse backgrounds, not rushing into advanced certifications, and knowing when to refer clients, especially when traditional methods aren't working. She also emphasized developing multicultural awareness early and being patient with your journey. Competence, she said, is more important than collecting credentials. This interview has been meaningful for me on multiple levels, professionally, academically, and personally. As a combat veteran, I've had my own journey with mental health. I shared with Dr. Parker-Austin that I've had negative experiences with civilian therapists who didn't understand military culture, terminology, or the unique challenges that veterans face. Hearing her talk about the lack of representation for minority veterans, Native Americans, and homeless populations really resonated with me. It validated many of the concerns I've seen firsthand in the veteran community. I also learned the importance of diverse mentorship, something she intentionally pursued. That challenged me to think about the kind of mentors I want to seek out as I move forward in the field. Her perspective on working with both survivors and perpetrators pushed me to think more deeply about prevention, accountability, and the long-term impact of trauma work. And her advice about not rushing into certifications reminded me that my lived experience, my military background, and my passion for advocacy are strengths, not things I need to overshadow with credentials. Overall, this interview strengthened my desire to serve veterans, especially those from minority backgrounds who often feel unseen or misunderstood in traditional mental health settings. It helped me see how my personal story, academic training, and future goals all connect. In closing, this assignment gave me a deeper appreciation for the counseling profession and the responsibility that comes with serving others. I'm grateful to Dr. Rosetta Parker-Austin for her wisdom, her honesty, and her willingness to pour into my journey, not just as a professional, but as a brother in Christ. Thank you for watching my presentation, and thank you for allowing me to share what I've learned through this interview. God bless.